We see a lot of patients with foot conditions that are best treated conservatively with the use of functional foot orthoses, or orthotics as they're known. Orthotics are essentially an insert that are worn in the shoe to rebalance the structure of the foot. Once this is custom made to the patient's condition, this insert then neutralizes the negative forces within the foot and helps restore better balance to the foot, similar to your eyeglasses restoring balance to your vision. Once they're in the shoe and functioning properly, the patient then can go on to do many of the activities that before caused pain. A lot of the conditions that we use orthotics in would be classically heel pain, plantar fasciitis, flat foot syndromes where you have pain along the arch of the foot. Children also benefit greatly from the use of orthoses by controlling the function of the foot. We feel that orthotics in the long-term use can reduce the chance of bunions forming down the road, and also can be treated in those patients with a very early bunion deformity. What we do to evaluate the patient for orthotics is typically what's called a biomechanical evaluation. This evaluation is performed to determine what imbalances exist, and typically we'll take a cast impression of the patient's foot, and that foot impression is then sent off to the orthotics lab, where a specific type of orthotic is made to accommodate that foot. We also design orthotics for specific function. That is, if you're an athlete, there are orthotics for runners, there are orthotics for golfers, there are orthotics for skiers. You can be very specific for function of the orthotic. There's also orthotics for of the everyday who do walk around and that sort of thing. And there's our specific orthotics for children where they are in-toeing or out-toeing or have very flat feet in childhood. We feel that if we intervene in children at a young enough age, let's say around the age of 3, by use of functional orthotics, we can actually help the foot mold in its growth to a better, more functional foot as an adult. This eliminates the flattening of the foot and reduces a lot of the symptoms and the processes that we see that are caused by flat-footedness in adults. In adults, by the way, you can also reduce a lot of the symptoms in the low back, in the knee, and in the hip area by the use of functional foot orthoses on an everyday basis to reduce the stress and strain in the lower extremity and to actually promote the normal shock absorption mechanism that the foot provides for the lower extremity.